Welcome to Washington Today on C-SPAN Radio for Thursday, December 2nd, 2021. U.S. House moving to pass a temporary federal government funding bill to avert a shutdown this weekend when current funding runs out. But a handful of Senate Republicans say they will delay a vote in the Senate and possibly cause a shutdown if they do not get a vote on an amendment to defund President Joe Biden's COVID-19 vaccine mandate for workers at large private companies. President Biden with new steps to address COVID-19 as more cases of Omicron variant are detected in the U.S. as we enter the winter months. Those steps include free at-home tests and stricter screening of international travelers to the U.S. Biden saying, "We're going to fight this variant with science and speed, not chaos and confusion." And Secretary of State Antony Blinken meeting with the Russian Foreign Minister Sergei Lavrov, talking about the Russian military buildup on the Russian border with Ukraine. Strong words from both men. And we'll talk about U.S.-Russian relations with James J. Carafano, a scholar at the Heritage Foundation. Story at Fox News. Congressional leaders on Thursday reached a deal on a stopgap funding measure through mid-February in an effort to avoid a government shutdown, though a temporary shutdown was still possible, with some Senate Republicans holding out over the White House's COVID-19 vaccine mandate for some workers. The U.S. House Appropriations Committee Chair Rosa DeLauro, Democrat from Connecticut, said in a statement that the agreement had been reached on a continuing resolution to extend spending to February 18th of 2022. Spending would remain at current levels, though $7 billion is included to support Afghanistan evacuees. The House working on this bill today, part of the House floor debate now with Congresswoman DeLauro.
It has been 30 days since I brought together a bipartisan, bicameral Four Corners meeting on November 2nd. And to date, we have not heard one word from them, not one word. But now, my Republican counterparts want more time, something that they have had since we came to this floor to pass the last funding extension 62 days ago, which means we now have no choice but to pursue a short-term extension. Make no mistake, a vote against this continuing resolution is a vote to shut the government down. The legislation before us, the Further Extending Government Funding Act, continues government funding at current levels through February 18. It makes minimal changes to address the most urgent of needs during the period of the continuing resolution and provides $7 billion to continue supporting Afghanistan evacuees after the end of 20 years of war. And while I wish the February 18th end date were earlier, and I pursued earlier dates, I believe this agreement allows the appropriations process to move forward toward a final funding agreement that addresses the needs of the American people. Let me be clear, working families, small businesses, veterans, and our military need the certainty that comes with passing omnibus funding legislation instead of short-term funding patches. Republicans must join us for bipartisan, bicameral negotiations to resolve our differences and keep government working for us all. For our communities, we need an omnibus to create and sustain good-paying jobs, support small businesses, prevent future pandemics, and advance life-saving medical research. We need an omnibus to strengthen public schools, protect our air and water, combat the opioid epidemic, and support core services such as food safety and consumer product inspections. Without an omnibus, investments in all these areas will be denied. For our veterans, we need an omnibus to provide sufficient funding for veterans' benefits, reduce backlogs for veterans and their families, and meet the needs of the VA's healthcare system. Without an omnibus, there will be a shortfall that will cause veterans not to receive their benefits in full. For our national security, we need an omnibus to support defense readiness and modernization, secure our cyber infrastructure, and strengthen American leadership abroad. Without an omnibus, a pay raise for troops will not be funded, while funds will be misdirected to a war we are no longer fighting.
Rosa DeLauro is chair of the House Appropriations Committee, part of the floor debate on the temporary government funding extension. She was referring to an omnibus bill. That would be the bill that would fund the government through the entire fiscal year through the end of October of 2022, still under negotiation. Ranking Republican on the Appropriations Committee, Kay Granger of Texas, also talking about this temporary measure.
I must admit that I'm disappointed to be on the floor of the House today to speak about a continuing resolution rather than fulfill year appropriations bills. But earlier this year, my colleagues on the other side of the aisle crafted fiscal year 2022 bills with little input from Republicans, and we have not been able to find a path forward. During markups this summer, our members made it clear we would not support partisan bills that include irresponsible spending increases and extreme policies. Unfortunately, that is exactly where we find ourselves. The House and Senate bills were drafted to top-line spending levels that do not reflect a bipartisan consensus. The majority people also focused funding on their own priorities, with non-defense spending increasing at a much higher rate than defense spending. And last but certainly not least, the policies in the bills are the most extreme I have seen since I became a member of the Appropriations Committee. During 2019 and 2020, there were also strong differences of opinions, but we had an agreement in place that allowed us to negotiate final bills quickly.
Congresswoman Kay Granger, ranking Republican on the Appropriations Committee, part of the House floor debate as the House moved towards passage of the temporary government funding measure. If they pass it, it would head to the Senate. Again, the deadline to avoid a federal government shutdown would be Friday night, 11:59 p.m. Eastern. Once you hit midnight into Saturday, the government would be shutting down as the previous authorization of government spending will have expired. But a group of Senate Republicans say they will hold up the bill unless they get a vote on an amendment to defund President Biden's COVID-19 vaccine mandate for large employers. The Senate Majority Leader Chuck Schumer speaking about all this on the Senate floor Thursday morning.
I begin this morning with some good news. I'm happy to say that last night I reached an agreement with Leader McConnell, the Speaker, and the Chair of the House Appropriations Committee and the Senate Appropriations Committee on a continuing resolution that will keep the federal government funded through mid-February of next year. This is a good compromise that allows an appropriate amount of time for both parties in both chambers to finish negotiations on appropriations. This morning, the House, excuse me. As I said, this is a good compromise that allows an appropriate amount of time for both parties in both chambers to finish negotiations on appropriations. This morning, the House will start the process to take up this government funding measure, and we hope they can have it passed through their chamber by the end of today. Unfortunately, it seems Republican dysfunction could be a roadblock to averting an unnecessary and dangerous government shutdown. Democrats and most Republicans, including the Republican leader, have said they don't want to see a Republican shutdown. We hope cooler heads will prevail. But just as we saw with the NDAA, a few individual Republican senators appear determined to derail this important legislation because of their opposition to the President's life-saving vaccine guidelines critical to healing our country in the middle of a pandemic. Let's be clear, if there is a shutdown, it will be a Republican anti-vaccine shutdown. Democrats want to get the government funded as soon as possible. It was not easy to reach this deal. It took a while to get Republican leadership on board, but I'm glad that we've gotten it done. I thank my colleagues on the other side of the aisle for working with us to find a path forward. Now all that's left are a few lone holdouts raising objections that are doomed to fail and which can be debated elsewhere. There's no reason we should have a Republican shutdown. I have worked with the Republican leader on an agreement that will avoid one. Now, again, I hope cooler heads will prevail on the other side so we can keep the government funded before tomorrow's deadline.
Senate Majority Leader Chuck Schumer, Democrat from New York, on the Senate floor. 15 Senate Republicans sent Senator Schumer a letter on Wednesday threatening to shut the federal government down unless there was a vote on an amendment related to President Biden's COVID-19 vaccine mandate for the private employers with 100 or more employees. Senators writing that President Biden is, quote, waging a cruel campaign to punish unvaccinated Americans. Today, one of those Republican senators, Mike Lee of Utah, spoke about this on the Senate floor.
I recognize that these vaccines are protecting Americans from the harms of COVID-19, and that the government has no business, no authority, and no justification to make millions of Americans second-class, unemployable pariahs. Even if the federal government did have that authority, which it doesn't, the President of the United States could not exercise it unilaterally, not without an act of Congress. Our economic condition is increasingly dire. Inflation is becoming long-lasting. The supply chain crisis has shown the prime value of American workers. And you know, I can't think of a worse time to kick them to the curb. I want to be very clear. I don't want to shut down the government. The only thing I want to shut down is Congress funding enforcement of an immoral, unconstitutional vaccine mandate. However, if the choice is between temporarily suspending non-essential functions on the one hand, and on the other hand, standing idle as up to 45 million Americans lose their jobs, their livelihoods, and their ability to work. I'll stand with American workers every time. That's not a close question. So, Mr. President, I stand with American workers throughout Utah and across America. I stand with moms and dads needing gifts and paychecks before the holidays. I stand by what I and others committed to as our word. That word given a month ago without response. I won't support a continuing resolution that funds President Biden's grievous, immoral, unconstitutional vaccine mandate. And I just want to vote on it in connection with this spending bill. All I'm asking for is a vote.
Senator Mike Lee on the Senate floor. He later told reporters that he would require a 51-vote threshold for such an amendment, not a 60-vote threshold to pass, should they get a vote on that amendment. And that would mean that if all Republican senators vote to defund the vaccine mandate, they would only need one Democrat to cross over for it to pass. The Hill newspaper writing today, Senator Joe Manchin, Democrat from West Virginia, declined to say Thursday how he would vote on a GOP effort to defund President Biden's vaccine mandate for large businesses. Manchin asked if he would vote for an amendment to block funding for the mandate, sidestepped the question by saying that he was still working through it. He said, "I've been very supportive of a mandate for federal government, for military. I've been less enthused about it for the private sector." That from The Hill. President Biden talking about this during his speech on COVID-19 at the National Institutes of Health.
You all know that there are literally, as it relates to whether or not we're going to pay the federal debt, whether we're going to, in fact, have a continuing resolution, et cetera, some of my friends on the other team are arguing that if I don't commit that there'll never be any more mandates, they're going to let us default. In the neighborhood I come from in Claymont, they'd look at me and say, "Go figure. Go figure."
President Biden, part of his speech at NIH, it was mostly on COVID-19, and we will have more on that later in this program. After the speech, the reporter asked him specifically if he thought the federal government would shut down.
Will there be a government shutdown on Friday, sir?
No.
How would you do it?
How could you ask such a silly question? Look, I don't believe that will happen. We have everything in place to be able to make sure there is not a shutdown unless some individual, I spoke with Mitch McConnell, I spoke with Schumer. There is a plan in place unless somebody decides to be totally erratic, and I don't think that will happen. So I don't think we'll be shut. Thank you.
President Biden at the National Institutes of Health. Later at the White House, Press Secretary Jen Psaki asked that whether the federal government was at least preparing for a possible shutdown.
Have you started to take steps to prepare for a possible shutdown, even if it is, just one that lasts through the weekend?
Sure. So there are steps that are taken by the OMB, our budget team, that are standard, and they're not steps taken out of an assessment or evaluation of what's possible or the legislative possibilities. They typically start engaging with agencies about a week in advance of any scheduled timeline for government funding. They did that as of last Friday. They had another scheduled time to engage with agencies today. So that is standard operating procedure, and that's underway. But again, our objective is, of course, to prevent the government shutdown. We are, and of course, that's up to Congress to get done.
The White House Press Secretary Jen Psaki. While some Senate Republicans are objecting to moving ahead with the temporary government funding measure, as mentioned, 15 signing a letter to the Senate Majority Leader, the Senate Republican leadership agreed to the deal as is, including Richard Shelby of Alabama, ranking Republican on the Appropriations Committee, and Mitch McConnell of Kentucky, the Senate Minority Leader. McConnell was interviewed on Fox News Channel Thursday morning.
One of the issues that the members of Congress on both sides of the House and the Senate, they say that the #1 call into their office over the past couple of months has been about vaccine mandates. They don't want them. So they're urging you to try to figure out a way to strip out that funding for vaccine mandates, or make them strip out vaccine mandates so that this government can continue to run. Here's a House Freedom Caucus letter to you. We therefore write to request that you use all procedural tools at your disposal to deny timely passage of the continuing resolution unless it prohibits funding in all respects for the vaccine mandates and enforcement thereof. This is all happening as we are on the clock to see if the government will continue to be funded. What do you think happens today? Will those vax mandates stay in the bill?
Well, I think there's good news. Multiple courts have pushed the pause button on these government vaccine mandates. There's a decent chance the courts will strike them down. Secondly, next week we're going to have a vote on the vaccine mandate prohibiting that regulation from going into effect. I think it has a decent chance of passing the Senate. I don't think shutting down the government over this issue is going to get an outcome. It would only create chaos and uncertainty. So I don't think that's the best vehicle to get this job done. I think the courts are likely to get it done, or will pass early next week, freestanding a measure to overturn the government mandate.
Just to put a fine point, you're saying you can avert a shutdown or not, sir?
Yeah, we're not going to shut the government down. That makes no sense for anyone. Almost no one on either side thinks that's a good idea.
Senate Minority Leader Mitch McConnell on Fox News Thursday morning. If the Senate were to amend the House-passed bill, which temporarily extends government funding through February 18th beyond the deadline, which is Friday night into Saturday morning, if the Senate were to amend the bill, it would need to go back to the U.S. House for another vote because a single version needs to pass both chambers of Congress in order to be signed into law. House Speaker Nancy Pelosi asked today during her weekly briefing if she plans to keep House members in session to deal with that possibility.
Are you going to, in anticipation that the Republicans might slow this up, the government funding, will you keep the House here this weekend, or do you plan to let them disperse after you pass this?
Well, we anticipate that the Senate will pass the legislation. I don't think that they're anti-vaxxing thing. How do they explain to the public that they're shutting down government because they don't want people to get vaccinated? Why don't you go ask them? This is so silly. This is so silly that we have people who are anti-science, anti-vaccination, saying they're going to shut down government over that, and you're asking me what's our message. Our message is that we have to respect governance, and we have to respect science, and that's what we are doing, and we will pass this legislation. Our members, whether they are here or they are home, stand ready to keep government open. It doesn't matter their location. Mr. Hoyer was very clear in our caucus this morning, in our whip meeting this morning, that while we are optimistic about what it is, we'll stay close to ensure that but it's not. We're not going to go for their anti-vaxxing, okay? So if you think that's how we're going to keep government open, forget that. Forget that, okay?
House Speaker Nancy Pelosi, Democrat from California, at her weekly news conference. As this all plays out, you can follow the House and Senate live gavel to gavel on the C-SPAN Now video app, on the C-SPAN TV networks, and at cspan.org. On Wall Street today, a rebound. The Dow up 617, NASDAQ up 127, S&P up 64. Washington today continues in a minute.
The U.S. Supreme Court recently heard oral argument in an abortion-related Mississippi law that some observers say poses the biggest challenge to Roe v. Wade in a generation. On C-SPAN's The Weekly Podcast, we look back at 30 years of Supreme Court Justice confirmation hearings to hear what nominees said, or didn't say, when asked for their positions on abortion and Roe v. Wade. You'll hear from each of the current 9 sitting justices from their confirmation hearings, like this exchange on September 13, 2005, between Republican Senator Arlen Specter and President George W. Bush's nominee for Chief Justice, John Roberts.
Well, do you see any erosion of precedent as to Roe?
Well, again, I think I should stay away from discussions of particular issues that are likely to come before the court again. And in the area of abortion, there are cases on the court's docket, of course. It is an issue that does come before the court. So while I'm happy to talk about stare decisis and the importance of precedent.
Find it and follow wherever you listen to podcasts.
Welcome back to Washington Today, which you can get as a podcast. Find it on the C-SPAN Now app and wherever you get your podcasts. A few more headlines. Migrants seeking to enter the U.S. will again need to stay in Mexico as they wait their immigration hearings. The Biden administration announcing plans to reinstate the Trump-era policy after agreeing to Mexico's conditions for resuming it. Associated Press reporting Mexico's conditions include COVID-19 vaccinations for migrants, more protection in dangerous Mexican border cities, better access to attorneys, and quicker resolution of cases. AP writes about 70,000 asylum seekers have been subject to the policy, which President Trump introduced in January 2019 and which Biden suspended on his first day in office. And the New York Post reports that the U.S. Department of Justice is investigating sexual harassment claims made against former Governor Andrew Cuomo, Democrat from New York, that according to a document the Post obtained through the Freedom of Information Act. President Biden announcing today several steps to fight the COVID-19 pandemic over the winter as the Delta variant continues to spread and the Omicron variant seems poised to do so. The steps include requiring private health insurance companies to reimburse 100% of the cost of free at-home coronavirus tests and making millions more free tests available through clinics, requiring international passengers arriving in the U.S. to be tested for COVID-19 within 1 day of departure, regardless of vaccination status, and extending the mask mandate on airplanes, trains, and public transit through mid-March of 2022. President Biden visiting the National Institutes of Health in Bethesda, Maryland.
There are 5 key actions that I want to see us take this winter. First is expanding the nationwide booster campaign with more outreach, more appointments, more hours, more times, and sites to walk in, providing boosters shots for up to 110 million Americans who are eligible for boosters. And I want to know parenthetically, I was talking to one of my folks who does polling and national strategy, and he said there's some evidence in one poll, I won't mention it because I'm not positive of the number, I was told this as I was leaving the White House, that there is an expectation that 30% of the non-vaxxers said under no circumstances would I get a vaccination, because of the new variant, are now saying I'm going to get a vaccination. So we hope that's true. I hope that's true. But the second point is that launching new family vaccination clinics to make it easier for children, parents, and whole families to get vaccinated in one place. And new policies to keep our children in school instead of quarantining them at home. I'll talk about the detail of each of these in a moment. The third piece of this is making free at-home tests more available than ever before and having them covered by your private insurance plans available in thousands of locations and available at community health centers and other sites for the uninsured who don't have insurance. 4, increasing our surge response teams that our doctors, our nurses, I know people in this audience know incredibly well about what a surge team is, but medical staff into communities with rising cases and overburdened hospitals and short on personnel. And by the way, they make a gigantic difference. The governors, Republican governors as well as Democratic governors, contact me when I go into their states, talk about thank you for these surge teams, because it really makes a difference in some communities are hit so much harder than others. They just, they just can't make it without. And what we're going to do, I'll speak to this in more detail in a second. The 5th thing we're doing, we're going to accelerate our efforts to vaccinate the rest of the world and strengthen the international travel rules for people coming to the United States. My plan I'm announcing today pulls no punches in the fight against COVID-19, and it's a plan that I think should unite us. I know COVID-19 has been very divisive in this country. It's become a political issue, which is a sad, sad commentary. It shouldn't be, but it has been. Now, as we move into the winter and face the challenges of this new variant, this is a moment we can put the divisiveness behind us, I hope. This is a moment we can do what we haven't been able to do enough of through this whole pandemic. Get the nation to come together, unite the nation in a common purpose, to fight this virus, to protect one another, to protect our economic recovery, and to think of it in terms of literally a patriotic responsibility rather than somehow you're denying people their basic rights.
President Biden at the National Institutes of Health in Bethesda, Maryland. Nathaniel Weixel is a health reporter with The Hill joining us now. He's been following the announcements today. Thank you for being with us. If the goal is to slow the spread of COVID-19, especially with the new variant on the horizon, was what the president announced today enough?
Really what the president is doing is leaning into the authorities that he's already has. Obviously there's a concern that cases are going to rise in the winter, and he alluded to that today too, that, as the weather gets colder, as people go inside, cases are going to go up, but it's a matter of sort of, as you said, stopping the worst of this spread. Some of the policies that he's doing will help. Some of the experts that I've talked to have said, really the key is vaccinations, and a lot of what he's doing is focused on improving access to vaccines, getting more vaccines out there, getting more boosters out there, and really just trying to encourage people to get the shots.
The president made a point of saying today that he is not expanding vaccine mandates, and that continues to be a contentious policy.
Yeah, most of the mandates that he has tried to put in place have right now been blocked in federal court. So, every turn there is sort of a challenge to them from a Republican governor, a Republican, conservative group that wants to challenge it. So he's a little bit hamstrung in terms of whether he can actually move forward with the mandates. But what he's doing is just sort of encouraging businesses to do it anyways, because private businesses can do what they want. So, in the administration's view, mandates work. The more people get vaccinated, the more people are protected from any, from coronavirus, whether it's Omicron or whether it's Delta variant. So mandates are getting people vaccinated, and, they want businesses to do it, whether the federal government forces them to or not.
Was there anything the president announced today that might be challenged or opposed by the congressional Republicans or businesses? Anything strike you?
Most of what he said is sort of just building on what they're already doing. The one issue that they might run into is, getting private insurance to cover at-home coronavirus tests. It's not necessarily that it's going to be challenged. It's just that it could prove to be a bit more complicated than they want it to be, because from what it sounds like is, if you have private insurance, you're going to have to pay upfront to get this test at CVS or Walgreens or Walmart or what have you. And then likely you're going to have to save the receipt and submit it to your insurance company. And then you're going to have to get reimbursed from them. And it just seems like that could be a little bit more challenging. And some of the health experts who I've talked to sort of thought that, he could have streamlined it a bit more and, maybe made the tests free, subsidize them somehow, rather than jumping through the hoops of insurance companies. But nothing was really all that controversial, sort of, as you said. He's not doing any additional mandates. He's not doing anything more really than what he's already been doing.
Nathaniel Weixel is a health reporter with The Hill. Today's steps, as you mentioned, advertised as needed because winter is coming. Why is that a concern, and what has been the trajectory of COVID cases in the United States lately?
Yeah, COVID has been rising. Delta variant is accounting for what CDC said the other day, over 99% of the cases. So, we were doing pretty well, and then Delta came along and cases started skyrocketing. So they're still rising, and more than 2,000 people are dying. People are still going to the hospital. So it's not a great, not doing great right now. So as people get inside when the weather is colder in colder weather states, they congregate indoors. If there's low vaccination areas, there's more opportunity for spread. So, that's why cases are probably going to be climbing. And Biden alluded to this. He said, winter is coming. Be careful. Get vaccinated.
Nathaniel Weixel covers health issues for The Hill. Find his work at thehill.com and follow him on Twitter at Nate Weixel, Weixel. Thank you very much.
Thank you.
At the New York Times, Governor Kathy Hochul of New York said on Thursday that everyone who attended a recent anime convention in Manhattan should get tested for the coronavirus after an individual who tested positive for the Omicron variant in Minnesota recently traveled to the conference. The convention hosted 53,000 attendees over 3 days, according to a spokesman for the GOP Center. Governor Hochul held a news conference.
Just recently, we learned from the Department of Health in Minnesota that one of their constituents has tested positive for Omicron. This individual had spent time in New York City. They were at a conference at the GOP Center. We have been in touch with the GOP Center. I just spoke with Alan Steele a few minutes ago. I've been in contact with New York City, spoke to Mayor de Blasio. An individual I'm going to be introducing shortly, Dr. Mary Bassett, our new health commissioner, has also been in touch with the New York City Department of Health. The information is still evolving, but we understand that this individual, while they were vaccinated, they have very mild symptoms, and in fact, those symptoms have already resolved. That is good news. And what we want to make sure we know is that there is one way to address this. New Yorkers, get vaccinated, get boosted, and get ready. We do anticipate there'll be more cases, but to the extent that they are mild, we'll address them. This is not cause for alarm. Again, it was foreseen ever since it was first reported out of South Africa that we knew it would come to New York State at some point. And I want all New Yorkers to know that their state government, in collaboration with our local governments, our cities and our counties, are prepared for this. We are ramping up our efforts to get more vaccinations out there, ensuring that there's no area of the state where someone can uneasily access a vaccination, but we believe that the vast majority of the state is covered now. Testing is widely available, and we encourage people who have been at a conference recently at the GOP Center during the dates of November 18th and 22nd that they also get tested, and we're going to make sure that everyone knows. We have a way to contact these individuals. There is a list of individuals who attended, and also they were vaccinated in order to go into this conference in the first place. So no confirmed cases in the state of New York. However, we are very cognizant of the fact that it is very likely soon that someone is going to test positive for this. We've been ready. We're prepared. We're not sounding the alarms. We're not overreacting to this. But I want New Yorkers to have the confidence to know that we are ready to deal with this.
New York Governor Kathy Hochul, a Democrat, at a news conference today. A third COVID-19 Omicron variant case in the U.S. turning up today in Colorado. Governor Jared Polis, also a Democrat, and the state epidemiologist confirming the case, a woman who recently traveled to Africa. The U.S. House Energy and Commerce Subcommittee on Health held a hearing today on combating the drug fentanyl. The subcommittee writing that drug overdose deaths reached a record high of more than 100,000 in the 12-month period between April 2020 and April 2021. Latest data show that synthetic opioids have contributed greatly to this increase, and research suggests that the increase in synthetic opioid-related overdoses is largely due to illicitly manufactured fentanyl, including fentanyl analogs. That was from the subcommittee. One of the witnesses today, Louis Milione, Principal Deputy Administrator at the DEA, Drug Enforcement Administration.
DEA's fentanyl seizures this year have reached an all-time high, largely because of the temporary class-wide scheduling of fentanyl-related substances. We've already seized 13,000 pounds of fentanyl this year. That's enough fentanyl, as was mentioned earlier, to give every member of the United States population a potentially lethal dose. What is extremely alarming is that Mexican cartels and other criminal networks are mixing fentanyl with other drugs like cocaine, meth, and heroin, and also marketing this fentanyl in a new form, fake prescription pills. These pills are filled with deadly fentanyl and pushed on our population by these criminal networks. They're made and marketed to deceive users, often on social media platforms, making their target audience think that the fake pills are legitimate prescription medications, but they're not. So far this year, DEA and our law enforcement partners have seized more than 15 million fake pills. 10 million of these pills were laced with fentanyl. DEA's lab testing confirmed that 4 out of 10 of these pills are laced with a potentially lethal dose. As I said earlier, DEA's mission is to protect the public. We are laser focused on this threat. In September, we issued our first public safety alert in 6 years, warning the public about fake pills laced with fentanyl. The prior public safety alert was also dealing with fentanyl. At the same time, we launched a public awareness campaign titled "One Pill Can Kill," trying to get the message to anyone we can reach that just one of these fentanyl-filled fake pills can kill a user. We also did a nationwide enforcement surge focused on the fentanyl and counterfeit pill threat. Over a period of 6 to 8 weeks, we took action in all our DEA offices around the country. We seized millions of fake pills, thousands of pounds of fentanyl powder, dozens of guns, and arrested more than 800 drug traffickers. We will be relentless in the work that we have to do to protect the public. The fentanyl threat, as I said earlier, is an existential threat to our country. Now more than ever, it is critical that Congress permanently schedule fentanyl-related substances as a class to enable DEA and our law enforcement partners to seize these substances before they enter the country and as they are encountered in our communities.
Louis Milione is the Principal Deputy Administrator at DEA, Drug Enforcement Administration, testifying today before the House Health Subcommittee. Fentanyl is a powerful synthetic opioid up to 100 times stronger than morphine. It's a prescription drug used to treat patients with severe pain, but is also made and used illegally. This from Reuters. U.S. Secretary of State Antony Blinken warned Moscow of the severe costs Russia would pay if it invaded Ukraine, urging his Russian counterpart on Thursday to seek a diplomatic exit from the crisis. Blinken delivered the warning to Russian Foreign Minister Sergei Lavrov at what he called a candid meeting in Stockholm, and said it was likely that Presidents Joe Biden and Vladimir Putin would speak soon. That reporting from Reuters. We'll hear from Secretary Blinken in a moment. First, here is the Foreign Minister, Sergei Lavrov, talking about Ukraine, remarks he made at a joint appearance with Blinken before their private meeting.
The fact that everyone is talking about the escalation of tensions in Europe on the border between Russia and Ukraine, well, you know very well how we treat this. We, as President Putin stated, do not want any conflicts. But if our NATO partners have stated that no one has a right to dictate to a country that would like to join NATO whether it can do or not, we can say that every country is able to define its own interests to guarantee this security. And we can refer to the principle of indivisible security envisaged in the EU and NATO documents, which is that no one can guarantee its own security at the expense of the security of others. And NATO's extension to the West will infringe upon our security, obviously. This is what we are going to do, but I will stay here.
The Russian Foreign Minister Sergei Lavrov's statement through an interpreter. Lavrov sitting next to Secretary of State Antony Blinken in Stockholm, Sweden, at a meeting of the Organization for Security and Cooperation in Europe. Following their joint statements, the two met in private, and then after, Secretary of State Blinken spoke with reporters.
In my meeting with Foreign Minister Lavrov, I made very clear our deep concerns and our resolve to hold Russia responsible for its actions, including our commitment to work with European allies to impose severe costs and consequences on Russia if it takes further aggressive action against Ukraine. And as with Foreign Minister Kuleba, I also made clear the United States is prepared to work with both parties to support a diplomatic resolution through implementation of the Minsk agreements in any way that we can. That diplomatic way forward can avert a crisis that would serve no one's interests. Foreign Minister Lavrov and I had candid exchanges on our different perspectives. We agreed to report those back to our presidents, who may have the opportunity to speak directly in the near future. It's now on Russia to de-escalate the current tensions by reversing the recent troop buildup, returning forces to normal peacetime positions, and refraining from further intimidation and attempts to destabilize Ukraine. We're watching this situation very closely. We're in close contact and coordination with our allies.
Secretary of State Antony Blinken in Sweden. More on Ukraine and U.S.-Russia relations. Joining us on the phone is James J. Carafano, Vice President of the Heritage Foundation Institute for National Security and Foreign Policy. Thank you so much for joining us. The rhetoric,
it's good to be with you.
The rhetoric and threats from the Western nations and from Russia over Ukraine has been building lately. How serious a situation is this?
Well, on the one hand, I think it is serious. You know, on the other hand, I think it's like the opening scene from The Sharks and the Jets, where I'm not sure anybody's really going to start throwing punches. So it's pretty easy to wave your hands and yell and scream and blow fists at each other. I mean, there's a good argument. Look, first of all, the only person that knows what's really going to happen is named Vladimir Putin. And he is going to do the calculation of in his head on the next step, and that's what's going to happen. And unless you happen to be, with him at breakfast when he wakes up and decide, I don't think anybody knows for sure. That said, the Russians are in a pretty strong position here. Let's run this out and say they invade Ukraine. How does that really benefit Russia? They will be occupying the country, which will be enormously expensive. They will, again, become a world pariah. The Ukrainians will fight back. There will be terrorism and insurgents and everything else, and it will be a huge drain like Afghanistan. Now, okay, so you've conquered Ukraine. People will fear you. I get that. But look at the situation he's in now. He has everybody's attention. He can decide which way this goes. Why taking this to an actual big shooting war? What advantage would that give him?
There's word today that after the diplomats didn't reach an agreement, that President Biden and Russian President Putin will be discussing Ukraine one-on-one in the near future. Will that help?
It'll help Putin because he's got all the cards. It doesn't really help Biden because, one of two things will happen. Either Biden will concede nothing, which will be a failure, or Biden will have to give Putin things he wants in order to get Putin to agree not to invade. And we don't even actually ever know if he was going to invade. And he'll look weak. So I don't see how this strengthens the president's hand.
How has President Biden dealt with Russia so far in the first year of his presidency, and how's that differed from what President Trump did?
Well, Biden's dealt with his first year of his presidency much in the way Obama dealt with it during his presidency, which is they wanted to just try to ignore Russia. This notion that, look, we'll give you what you want. So in this case, he gave him Nord Stream 2. We won't really be aggressive towards you, and that will satisfy you. And essentially, you're leaving us alone. And unfortunately, what we see with Putin is Putin sees that as weakness, and it's an invitation for more aggression. So it's not surprising that it didn't work terribly well. But then why should we be surprised that this is what they did? Because essentially it's all the same people that were there in the Obama administration.
If you were advising President Biden now, what would you tell him about Ukraine and about dealing with Russia in general? What advice would you give?
Well, I think the U.S. is in a strong position to do a more muscular pushback on the Russians, because I don't think either side is really willing to put it trade. And actually, I think if the U.S. if we look so incredibly weak, if essentially what we say is, well, we will do more sanctions, which are not a deterrent to Russia. Russia knows how to survive sanctions. You use sanctions to punish people. You don't use it to deter them, because it doesn't work. It doesn't work with your 5-year-old. It doesn't work with Putin. The weaker we look, we're actually creating But some people say, well, don't antagonize things, don't inflame the situation. Then that'll anger Putin. But the reality is the more he senses his weakness, he'll decide, well, maybe I can take Ukraine and get away with it. So by looking weak, we would actually, I think, really precipitate a war. And what would you do differently? Well, look, the Trump era worked. Trump never said he was going to overthrow Russia or bomb it into the Stone Age, but what he made it very clear was that the U.S. was going to lean forward and defend its interests. And the Russians respected that. There's a very famous incident in Syria where it was the moment that the Russians took the Americans most seriously, is that there were some Russian mercenaries and they were, pressing on some American positions, and the president just ordered to bomb the hell out of them. And Putin woke up the next morning and said, I understand that. No, I'm not saying we bomb stuff, but and look, Ukraine is not a member of NATO. We do not have to go to Ukraine's defense. Having said that, we can provide and ought to offer up every resource and capability, and that would, I think, be an effective deterrent.
James J. Carafano, the Vice President at the Heritage Foundation. You can find his research at heritage.org and follow him on Twitter at JJ Carafano. Thank you very much.
Thanks for having me.
From USA Today, Simone Sanders, Vice President Kamala Harris's chief spokesperson and senior advisor, is leaving the White House at the end of the year, according to an administration official who spoke on condition of anonymity to discuss the announcement. The announcement follows a string of media reports of turmoil within the vice president's office and tension between Harris and the West Wing. White House officials and Harris have disputed those claims, but Sanders' exit marks the second departure from the vice president's office within weeks. That reporting from USA Today. Vice President Harris asked about this during a trip to Charlotte, North Carolina, on the airport tarmac with reporters.
Do you have a response to Simone leaving the office? And also,
I love Simone, and I can't wait to see what she will do next. And I know that it's been 3 years of a lot of jumping on and off planes and going around the country, and she works very hard, and I can't wait to see what she'll do next. And I mean that sincerely.
There's obviously others as well. Do you feel like you're in the middle of a staff shakeup, and do you see this as a reset for your office?
Well, I've told you how I feel about Simone. Yeah. Next question.
Vice President Kamala Harris with reporters on the tarmac at the airport in Charlotte, North Carolina during today's trip. Thanks for listening to Washington Today. For more top Washington stories, subscribe to C-SPAN's evening newsletter word for word at c-span.org/connect. Hope you have a good night.
C-SPAN's Washington Journal. Every day we're taking your calls, live, on the air, on the news of the day. And we'll discuss policy issues that impact you. Coming up Friday morning, Ohio Republican Congressman Bill Johnson discusses the Biden agenda, government spending deadlines, and energy costs. Then, Oregon Democratic Congresswoman Suzanne Bonamici on the COVID-19 response and climate change. Watch Washington Journal, live at 7 Eastern Friday morning on C-SPAN or C-SPAN Now, our new mobile app. Join the discussion with your phone calls, Facebook comments, text messages, and tweets.